This point here, in 2007, is the lowest suicide rate on record for England. And records began in 1861. And then this point here, in 2017, is almost as low. Now, there's always a but in suicide statistics. And in this case, it's what happened in between these 2 points, which is a comparative rise. And at its peak, it was around 700 extra suicides per year in England. And it followed the 2008 recession. And it makes a very important point that suicide rates are very sensitive to economic circumstances, one of the main drivers of suicide, and a particularly important concern as we move into a period of economic stresses just now with the cost of living crisis. Thank you, and hello, I'm Lewis Appleby. I'm Professor of Psychiatry at the University of Manchester, where I lead a research group on suicide and suicide prevention. I also chair the government's advisory group on the National Suicide Prevention Strategy. I'm going to talk today about suicide in men. I'm going to present a number of figures on recent risk and also some trends over the last several years. I'm going to tell you what I think we know about causal factors, which are then, I think, the priorities for prevention. You'll see some graphs, some lines going up and down in the way of academic data. But in our research unit, we always start by reminding everyone that the figures on the screen are not dry data. They are real lives. They are deaths not prevented. They are families devastated. Let's make a start. This slide is showing the suicide rate for England. The middle line there, the blue one, is males and females combined. It's the one to start with. So this is suicide over a period of about 20 years since the turn of the century, which is more or less the time when we've had a national suicide prevention strategy. There are, throughout this time, around 5,000 deaths by suicide a year. So there is nothing to be complacent about. But it is a fact that during this period, the suicide rate has been comparatively low, about 20% lower than in the 2 decades before this slide. And during this 20-year period, we've also had the lowest suicide rate on record. So I'm just going to go to a laser pointer now and show that. So this point here in 2007, so a few years into the strategy, is the lowest suicide rate on record for England. And records began in 1861. And then this point here in 2017 is almost as low. So we almost got down to the same figure. Now, there's always a but in suicide statistics. And in this case, it's what happened in between these 2 points, which is a comparative rise. And it may not look a big rise in the way that the line is presented there. But in fact, at its peak, it was around 700 extra suicides per year in England. And it followed the 2008 recession. And it makes a very important point that suicide rates are very sensitive to economic circumstances, one of the main drivers of suicide, and a particularly important concern as we move into a period of economic stresses just now with the cost of living crisis bringing difficult news for many people, many families. So that's the first time that during this graph when the suicide rate rose, but there's a second rise here in 2018, 2019, and that was caused by a change in the measurement. Not entirely, but importantly. So at that point, we changed the way that suicide was concluded at inquest, at coroner's inquest. The standard of proof was lowered. And so if you lowered the standard of proof required, then inevitably that you put the numbers up. And so that's the reason why that this period here shows a rise since this very low figure for 2017. An important point about what's on this graph is that this is the general population rate, the blue line, but you can see from the shape that it's very much driven by the green line, which is the male rate. And the male rate, particularly sensitive to those economic circumstances. Look at the rise here, much greater. The male rate 3 times as high as the female rate in this country. 1 in 65 of all male deaths in England is by suicide. Now, within every figure, there is variation. So this is now breaking down what you've just seen in the male rate, that line on the green line on the previous graph, now broken down by age group. And it's broken down into 5-year age bands. And to make the slide simpler, I haven't included every 5-year age band because it would be too busy, too difficult to decipher. So it's got a number of age bands. And this one here, coming out on top in this graph, is men in their early 50s. And men in middle age are a particular concern in suicide. And much of what I'm going to say in this talk, it will be about that group. So you can see why. So this is an example. They've got relatively high suicide rates. And in particular, you can see again, the impact of the recession was particularly strong in this middle-aged group. And there again, this rise at the end when we changed the measurement. So this is men in their 50s. Now, men in their early 50s now, 20 years ago, when this graph starts, were in their early 30s. And here's the graph of the line showing men in their early 30s, which at that time, when we started with the suicide prevention strategy, they were the group at highest risk. And they're still the group at highest risk, but they're now 20 years older. And that's known as a cohort effect, so that people carrying their risk with them throughout life. And so what we've got for middle-aged men at the moment is a confluence of 2 concerning factors. Historically high suicide rates in that particular group of people, even though they've aged during that time, and a greater sensitivity to economic hardship. Second thing in this graph to note is this line here at the bottom, the lowest suicide rate of any demographic group. These are males, of course, all males. So this is men and boys in their late teens. So although we're very concerned about that group, they actually have the lowest suicide rate of any age group. And then this one here, I want to mention as well, this is this sort of gray color, which isn't really showing the rises that I mentioned there. It's mainly falling from here in 2000 down to a lower figure here. This is men over the age of 75. Now, a few decades ago, this group had the highest suicide rate in England. And during the last 20 years, 25 years or so, their suicide rate has fallen so that they now have one of the lowest. The last time men over 75 had the highest suicide rate was 1994. So something has changed for older men. Their lives have become safer, less vulnerable to suicide. And it's probably a number of factors. No suicide effect is caused by one thing, but it would be hard to put aside the fact that healthcare for older people, and including mental health care, has been greatly developed during the last 3 or 4 decades. And that point about the role of healthcare is important. If we say that something as powerful as an economic recession can drive suicide rates up, can services really be expected to bring them down? What can services do about a worldwide recession? So this is a slide now showing mental health patient suicide rates during, well, not the whole period I've just shown you, but most of it. So this is the work of my research group. And during this time, so if we look first of all at the males and females combined line, that's this one. During this period, we've seen a very substantial fall in the suicide rate in mental health patients. And if we look at men, much of that fall has been because of improvements in the suicide rate in men down to this level here. It's around 70 deaths per 100,000 people per year. That's about 7 times the general population rate. So it is still a very high rate. I did say there was a but in every suicide statistic. It's come down, but it's still high. And it amounts to around 800 to 900 suicides by male mental health patients every year. Now, why this fall has occurred is, again, there are a number of factors. And one of them is that we now have far more people under mental health care. And if you bring more people under care, you probably bring people at lesser degrees of risk. And so you can expect the overall rate to go down. But there's good evidence in the data we collect that that's not the only reason. That in fact, services have become safer. Mental health services have become safer, particularly for men. And that's not always the story you hear about mental health care, but that's what the data suggest. Now, back to this middle-aged male group. Here we have men. This is an age and sex breakdown of suicide in the most recent year, for which we have full data pre-pandemic. The pandemic did distort the recording of suicide, so I'm showing the year before the pandemic, so 2019. And what you can see on the slide, simple message: this is the highest rate is in men in their 40s and early 50s, the group that I was referring to earlier. Around 1,500 deaths a year in men in their 40s and 50s by suicide. That's about 30% of all population suicides, just in that narrow age and sex group. And so the question is, what do we know about that group that might explain it? Well, there have been very few detailed studies of individual risk in male suicide, but this is the study that we carried out, one of the very few ones in this country or worldwide, where we obtained information about middle-aged men across the UK who died by suicide and used official sources, reports on deaths, and so on, in particular coroner's inquest files, which are a very rich source of data. And not only are they a rich source of data, but it's information from people who knew the person, from families, from professionals, from other agencies, from friends, people telling the coroner what they thought was happening in the lives of the people who died. And so it's a very good source of the stresses that people are facing at a time when they turn to suicide. And so this is what we found about middle-aged men. And just first of all, to stress one or two of the points that I've already been making, the importance of economic problems. So you can see here, I've done this as an infographic. This is meant to be an easier to digest summary of some quite complex data. So we found in about a third that they were facing recent financial problems. Many were facing problems in the workplace. Some were unemployed, facing problems of housing. Remember that economic problems are not one thing. They are not just about debt or employment, important though those things are. They affect the whole way of life that a person has. And so we're seeing that a range of economic related stresses in these middle-aged men. There's mental illness. I've talked about mental health and mental health services and their role. Very important factor, alcohol and substance misuse. These are some of the big drivers of suicide rates: the economy, mental illness, alcohol and drugs. And so it is with middle-aged men. Here, just to point out, is using the internet in a way that's related to suicide, not just a feature of young people, but I will say more about it in relation to young people shortly. And here is an important point, that about a third of these men who died also had a history of violence. And for that reason, many of them were in contact with the justice system. An important thing, a priority for suicide prevention: people who are in contact with multiple agencies, including the justice system. Not always the people who society is most concerned about, but in case of suicide prevention, they are very, very important. And it makes the point about services working together. In mental health care, we also have to work alongside prison and probation and other places where high-risk men turn up. We also looked in this study about at what kind of service contact people had had. So this is a slide showing contact with various services in the group of people who died. And the normal story about men is that they don't know how to seek help. They are reluctant. They can't talk about their feelings. Our study showed that that really was a rather simplistic view of men and their seeking help. But actually, the great majority had been in contact with some service at some time. And for many, it was recent contact. 2/3 had made contact with some kind of service in the 3 months before they died. And that would include mental health care and primary care, or it might be an A&E department, or again, there's the justice system. So they were in contact with services, and let's put this positively, there were opportunities for prevention, but that prevention didn't happen. And so it raises the question as to contact for what? What were they there for, and what happened to them? And it's probable that men, because of embarrassment and shame, and because of reluctance to conceptualize their problems in mental health terms, may not present in a way that brings out the help that they need. And it may also be that our services are not sufficiently vigilant about the people who present to them, not talking about mental health or suicide, but nevertheless at risk. And there is where we need another partnership, this time with the voluntary sector, because it is often the voluntary sector that provides the setting that is acceptable to men who are struggling. The voluntary sector don't necessarily mark their door with health, certainly not with mental health or suicide prevention. And so it's a more acceptable setting for men who feel ashamed of the way that they of what has happened to them. And sometimes the voluntary sector presents the reason for their service as being quite removed from mental health. It might be about sport or about social life or about men's hobbies. And that brings men in who might need to talk, who might need to find support. So another very important prevention partnership. Now, I just want to mention one other thing about middle-aged men. About men generally, I should say, and this is about the importance of ethnicity, very important issue in suicide prevention. We've never had good data on ethnicity and suicide until last year, when ONS, the Office for National Statistics, produced data on suicide rates in different ethnic minorities. This is their slide. I'm sorry, it's not particularly visually appealing as a slide, but it's showing a quite simple message. These are the suicide rates over a period of time, and the top group is in males. And so, what does it show? It shows, first of all, that the ethnic minority suicide rates were different. So we should stop talking about ethnic minorities as if they're a single group. They are a different group with different risks and protections. It showed that most, though, have a suicide rate which is below this line here, which is the rate in white British males. So in most cases, ethnic minorities do not have high suicide rates. However, there was an important exception, and it's this group here, the green line, and that's people of mixed or multiple ethnicity. And we have to understand their risk, which may be related to alienation from different communities within society, not having an identifiable community. Now, what about suicide in a different male group? And this time it's young people. I just want to spend the last part of my talk by talking about young people. Now, if you remember the bottom line from my earlier slide, it was showing the relatively low suicide rates in people in their late teens. But if you focus in on that line, there is a degree of detail which is important, and this is what happens. So there again is the general population line. So this is males and females combined. This one here at the top is young men or boys. And so what it's showing, first of all, is that the suicide rate in late teens is different from the fluctuating pattern I showed you at the beginning. It's unusually, unlike any other age group, there is a steady rise in suicide in this age group over the last 10 years, more or less since 2010. 2010 here is the key point. And again, look how closely the general rate, the male and female rate, follows the male rate. It's the male rate that is mainly driving this. It's not unique to this country. It's also true, rising suicide rates in young people in some other countries. They tend to be rich countries with high income inequality. So we did a similar study, using official reports to tell us what was happening in the lives of young people who died. And here is the first result. This is now breaking down what I've just showed you into individual ages in the mid and late teens. And it's, first of all, the blue part of the column here is the number of male suicides at each age. So you can see again the preponderance of men or young men and boys. But the most important thing is this very steep rise in suicide risk in the late teens. A very rapid escalation. There is no time in our lives when suicide rates rise in the way that they do in our late teens. Something is happening in the lives of young people, and we need to try and understand what it is. And so here is the same kind of infographic, the key risks identified through those reports. And again, there's a kind of pattern to it here. So if we look here, we were able to identify in the report some early experience, families with mental illness or substance misuse or domestic violence, experiences of abuse and neglect and maybe being in care. And then there are signs of, there's online risk. So again, this point about using the internet in a way that presents a risk, not just social media, but also searching for methods of suicide. The internet is a free-for-all of dangerous information on this issue, and we need to protect people. Online harms bill, of course, going through Parliament at the moment. Academic pressures were common. Some young people died on the day of an exam. And here we have the LGBT group, not huge numerically, 5%, that's about 10 deaths a year. I should mention this is based on about 600 deaths over 3 years. It's a very large sample, a tragic number actually, but 5% is only 10 deaths per year, but bound to be an underestimate. And for many of those LGBT young people, they had high rates of this phenomenon here, which was bullying and intimidation. So social prejudice, an important factor. So there's where prevention should target suicide in young males and in middle-aged males, the two groups we're most concerned about. And now we have a plan to revise the National Suicide Prevention Strategy. It's going on at the moment, consultation meetings happening right now. And where I hope we will get to is an updated strategy reflecting some of the evidence over recent years. Middle-aged men, children and young people, mental health patients, all of them will be prominent, but so too some of the issues I've talked about today. Here's ethnicity and online harms, LGBT groups and economic stresses, plus a few things that I haven't had time to discuss in this short talk. Suicide is a constantly changing phenomenon, and we need to be constantly vigilant. Thanks very much for listening.